Hi everyone, my name is Amber Malinowski and my presentation will be on Kaposi's sarcoma. What is Kaposi's sarcoma? Kaposi's sarcoma, or KS, is a cancer that develops in the cells that line lymph or blood vessels. In the United States, this cancer is most commonly associated with AIDS. KS usually appears on the individual as malignant tumors on the skin, mucosal surfaces like the mouth, in lymph nodes and/or other organs. The tumors that develop on the skin tend to look like purple, red, or brown blotches as shown in the photo to the right. This cancer is believed to be caused by the HHV8/KSHV virus. The virus is found in all lesions of those who have KS. Yet, just because someone carries the virus does not necessarily mean they will develop Kaposi's sarcoma. Types of Kaposi's sarcoma. There are 5 types of KS that have been identified. Most common in the US is epidemic KS or HIV/AIDS related KS. When it occurs, lesions surface in multiple parts of the body. When the disease spreads, it causes fever, weight loss, and/or diarrhea. Also seen in the US, non-epidemic KS develops in homosexual men who do not have the HIV virus. This is rare and progresses quite slowly. Classic or Mediterranean KS is found in mostly older Italian or Eastern Europeans with Jewish origin. The lesions grow slowly on their legs and feet. At times, other cancers may develop in the individual. Endemic or African KS usually develops in young adult males who live near the equator in Africa. The signs are the same as classic KS, but this type tends to be more aggressive. Sores may spread from the skin to the tissues and bone. At times, it is found in young children. When a young child is infected, it attacks their lymph nodes and vital organs, becoming fatal quite quickly. Finally, iatrogenic or transplant-related KS occurs in individuals who have had a transplant and have been given medications to suppress their immune system. This KS often only affects the skin. KS can be recurrent. Causes of KS. In the United States, epidemic and non-epidemic KS is thought to be spread during sex through saliva. In Africa, the virus is usually spread through childbirth. Classic KS is genetic. A weakened immune system allows the virus to multiply at high levels, increasing the chances of an individual developing KS. Consequently, this is why not every individual who is infected with the HHV8 virus will develop KS. It also explains how transplant-related KS occurs. If the virus is allowed to multiply, it will alter the genetic code controlling cell growth, leading to the formation of tumors. History and current statistics in the United States. Before the AIDS epidemic, KS was rare. There were only 2 new cases in every million people a year. These cases tended to be either classic KS or transplant related. Yet, when the AIDS epidemic struck in the 1990s, this number increased to 47 cases per million people per year. In the early years of the AIDS epidemic, patients with HIV were estimated to have a 1 in 2 chance of developing KS. Currently, rates have dropped to 6 cases per million people per year, found mostly in individuals infected with HIV. Drugs such as CART and other treatments for HIV and AIDS have reduced the numbers dramatically. Additionally, 1 in 200 transplant patients are thought to develop KS. Signs and symptoms. The most common initial symptom of KS is the appearance of small, painless, flat, and discolored patches on the skin or mouth. These patches slowly grow into lumps known as nodules. These nodules may then merge together. Another symptom that occurs is lymphedema, or an uncomfortable swelling of the legs. If the KS affects the lungs and/or GI tract, breathlessness, coughing up blood, chest pain, nausea, and/or diarrhea may occur. Tests and diagnosing. Skin, lung, and GI tract tests are used to detect and diagnose KS. If KS is found in an individual, blood tests are then used to see if the cancer has spread. Other tests include HIV tests, skin biopsies, endoscopies, and CT scans. Treatment options differ between the different types of KS, but between them there are 4 standard treatment options. The first being external and internal radiation therapy. This therapy kills the cancer cells and/or prevents them from growing. Second, surgery is used to treat small surface lesions. Third, chemotherapy uses drugs to stop the growth of the cancer. And finally, biologic treatment uses patients' immune systems to fight the cancer. Thank you so much for listening. Here are my references. You may click on any of them to learn more about KS.